Just having a very important topic of my lecture, and this will be posted on the YouTube, Dr. Kolachi also. The topic is public health problem solving paradigm. Paradigm means a kind of method, strategy. So this I have taken from the book of Public Health and Community Medicine by Mohammad Siddiqui. This is the 8th edition, and it is a textbook of MBBS and postgraduate in Pakistan. The problem solving, the start of the chapter, it writes that public health problem solving paradigm is a systemic way to identify and solve public health problems. So it is a systemic way of identifying and then solving the problem. So if there are at least 7 steps mentioned here to identify the problem. This is the first step. And second step is measuring the magnitude of the problem. How big is the problem? It is a medium size, it is a small size, or it is a very huge, or at a national internet. Just as we faced this pandemic of the COVID and other problems, and even the disaster. And then third is developing a conceptual framework to the key determinants of the problem. Developing a conceptual framework to the key determinants, which factors relate to happen this problem. So then in the fourth, that is identifying and developing intervention and prevention strategy. So this is the fourth. You have to go for the intervention, identify the and developing the intervention and prevention strategies. Then coming to the fifth side, it is setting priorities on strategy. Which should be the first step to solve this problem? Which should be second? Which should be third? If you will not prioritize, then you will not be able to. Then is the sixth and the last, implementing the strategy and evaluating the program or intervention. Evaluating means whether it has solved the problem, it has not solved the problem. If it has not solved the problem, then it goes to a very important chart. We call it bonefish chart, and that is you have to prioritize or write down the bonefish like structure or diagram, which is not here, but if my camera can show you from this book, this is bonefish chart, and we will also show in our slide also, and these are the 7 steps, and this is the book which I am referring in this lecture. My camera will show that this is 18th edition, and it was previously written by Ilyas Ansari Shah, and now the Irfan Mullah Siddiqui is the editor, and we are just delivering this lecture in Israel University for MCPS students, and some other important aspects which they are mentioning, that we have certain problems just like geriatric problems, the old age problems in Pakistan, as well as the environmental health problems and common communicable and non-communicable problems. So we have to define all these things, and there are certain other important aspects that the program or intervention should have effectiveness, feasibility, as well as it should have a political support and the social right and social will. Otherwise, you will not be able to solve the problem. And we have experience in the 2022 disaster, and Israel University team went to for medical camps and other uh, first aid and other relief activities in 8 districts, and we reached almost on 40,000 people. So this was a courage. It was very difficult. The boats were underwater. The security problems were there. The doctors to take them and to bring them was a huge cost also. It was a high expenditure. So I think with this, once again, I am just going to my slide side and showing you some of the material for your benefit, and you can see that public health problem can have these economic, ethnical, racial, gender issues, and then you can see that these are the subjects. Once again, you can see that to solve the public health problem, you should have these kind of approaches. I have already mentioned 6, defined from the definition, then magnitude of the problem, key determinants, program policy development, prioritization, implementation, and evaluation. That program has solved the problem or not. With this, I think I am ending this video presentation and lecture. But once again, I am thankful that I have used the material from a Pakistani book, because we are knowing that Pakistani problem can be described better by the Pakistani authors. So I have taken most of the time on this topic. Thank you very much, and please Dr. Kolachi YouTube channel as well as this public health lecture. If it is useful, please you should like, subscribe, and share it with understanding and post the students of Dr. Isra. Thank you very much.